Running Afinion lipid panel. The Afinion lipid panel is a rapid test for quantitative determination of total cholesterol, high-density lipoprotein HDL cholesterol, triglycerides, low-density lipoprotein LDL cholesterol, non-HDL and total cholesterol HDL ratio in whole blood, serum, and plasma, used in the diagnosis and treatment of lipid disorders. As a reminder, medical gloves should be worn. Make sure that the test cartridge has reached room temperature before use. Open the foil pouch immediately before use. Once opened, the test cartridge should be used within 10 minutes. Remove the test cartridge from the pouch by grasping it by the white plastic area to expose the handle on the bottom. Then grab the cartridge by the handle to fully remove from the packaging. Turn right side up and place on the bench. Be careful not to touch the lower part of the cartridge. Fingerstick, venous whole blood, serum, and plasma sample types may be used with the Afinion lipid panel. Sample volume is 15 microliters. To ensure the best results when obtaining a fingerstick sample, follow this simple step-by-step procedure. A warm hand and good blood flow are essential to collect a capillary sample. Wash the patient's hands in warm water or gently massage the finger from base to tip several times. Select a skin puncture site on one of the center fingers of either hand. Clean the finger twice using alcohol. Dry thoroughly with a gauze pad before pricking the finger. Use a suitable lancet and firmly prick the finger at the selected site. Squeeze the finger gently to obtain a drop of blood. Wipe away this first drop of blood. Squeeze the finger gently again until a second large, free-flowing drop of blood forms. Do not milk the finger. Excessive squeezing of the finger may cause an erroneous result. Pull the sampling device straight up from the test cartridge. Hold the sampling device tilted, slightly higher than the patient's finger, and touch the surface of the blood drop. Fill the capillary completely with a patient sample. Avoid air bubbles and any excess sample on the outside of the capillary. Do not wipe off the capillary. Do not tilt the sampling device downwards. Replace the sampling device carefully into the test cartridge. Analysis of the test cartridge must start within 1 minute. To run a patient sample test cartridge, touch the orange patient sample icon. The lid opens automatically. Remember, never try to open the lid manually. Insert the test cartridge carefully with the barcode facing left. Close the lid manually to start analyzing. If the patient ID function is enabled, touch the orange patient ID icon and enter the patient ID. Touch the Enter icon to confirm. The test result appears in 7 minutes. Record the result when it appears on the screen. The last 500 results are stored in memory and can be viewed in the main menu. If you have a printer connected, the print icon will appear and you can print the test result. Touch the green Accept icon to accept the result. The lid opens automatically. Please remember, never try to open the lid manually. Remove and immediately discard the used test cartridge. Close the lid manually when the analyzer is not in use. To interpret the test result, please read the package insert carefully. Venous samples may be used directly from the refrigerator. Mix the sample by gently inverting the tube 8 to 10 times before use. Remove the cap of the tube. Then remove the sampling device from the cartridge. Tilt the tube and place the tip of the capillary just beneath the surface of the sample material. Watch the blood fill the capillary completely. Avoid air bubbles and any excess sample on the outside of the capillary. To avoid excess sample on the outside of the capillary, the sample can also be collected from the cap, or you can use a smaller blood collection tube. Do not wipe off the capillary. Replace the sampling device carefully into the test cartridge and complete the procedure as described for fingerstick samples. Quality control testing should be done to confirm that your Afinion 2 test system is working properly and providing reliable results. Only when controls are used routinely and the values are within acceptable ranges can accurate results be assured for patient samples. Consult the package insert for recommended frequency of control testing. Quality controls can be used directly from the refrigerator. Mix the control material well by inverting the vial 8 to 10 times before collecting a sample. Pull the sampling device straight up from the test cartridge. Tilt the vial and place the tip of the capillary just beneath the surface of the control material. Fill the capillary completely with the control. Avoid air bubbles and any excess sample on the outside of the capillary. Do not wipe off the capillary. Replace the sampling device carefully into the cartridge and complete the procedure as described for fingerstick samples, except touch the blue control sample icon to run the control test. Replace the cap and immediately place the control vial back in the refrigerator. The measured value should be within the acceptable range stated in the Afinion lipid panel control package insert. On occasion, you may see an information code displayed instead of a result. For a full list of codes and their meanings, please see the Afinion 2 Analyzer User Manual.